up the conversation from the last segment where I was sort of talking about the management of breast cancer, lung cancer from the medical oncologist perspective of 40 years ago. And you know, for those of you listening, what I'm going to tell you now, you know, I think the key is just how much things have changed in those two common illnesses. Obviously, in breast cancer today, one would not think about management without looking at molecular characterization. We obviously have a variety of algorithms for use of hormonal therapy or chemotherapy in the adjuvant setting. And hormonal therapy is not just hormonal therapy now. We obviously use other drugs along with hormonal therapy. Multiple different approaches in the first line, second line setting. Molecular characterization is critical as we move forward. Neoadjuvant chemotherapy has become a standard, using radiation and surgery and the management of patients has now not become the question of simply sequential. You do surgery for breast cancer, then you give radiation, then perhaps you give chemotherapy or hormonal therapy. The therapies are considered multimodality from the diagnosis, which simply adds an enormous amount of complexity, thought processes, new information that comes up. And again, from the medical oncologist perspective, you're taking care of patients with breast cancer, you have to know all this. In addition to the question of, and by the way, there are now tumor agnostic drug indications which are to be considered. Sequential therapy is not the approach, it's the multimodality approach. And then we turn to lung cancer. And yes, small cell cancer lung cancer has not changed as dramatically as non-small cell lung cancer. But again, today, somebody with non-small cell lung cancer, you would not think about therapy unless you had done molecular typing to look for EGFR mutations, for ALK abnormalities, for ROS1, et cetera, et cetera. Standard of care, dramatically different treatments, depending upon the profile. And by the way, it's then following the patient along because resistance occurs, mechanisms of resistance are different mutations in EGFR can be very specific, and we have very specific drugs for those that are FDA approved. And so if you're taking care of somebody with lung cancer optimally, you have to know all this. You have to understand it. You have to know about the most recent advances, the most recent drugs, the most recent changes and indications. And I haven't even mentioned immunotherapy yet. But then when we add that is, well, what is the role of immunotherapy? Frontline, second line, with chemotherapy, with targeted therapy. When do you use it? What about the different drugs? And in the future, of course, we're going to be seeing the use of a variety of liquid tumor biopsies, which you will be able to monitor patients to potentially that therapy. That's a different paradigm than breast cancer. And so I just talked about these two diseases that are changing and will continue to change dramatically in terms of their therapy. And in the next segment, I'm going to talk a little bit about the difficulty of simply where we are and why we can't fix it, why it's so hard. I thank you for your attention.